morning, everyone. Thank you for joining us. This is our second webinar in our series of alternative funding concepts. Welcome back if you were here last week. If you were not and would like our recording, we are recording each one of these sessions, and you are welcome to request that and we'll send it over to you. We're excited to bring you the concept of self-funding and level funding today. It's going to be an introduction to this concept. We have Crumdale Partners with us today. Bree Bramber and Buzz Hanneman will be here presenting. I'm going to go ahead and let Lewis get started with introductions, and we'll turn it over to Buzz and Bree.
Thank you, Stephanie. Good morning, everybody. Welcome to our webinar series. We're excited to have you here. I just wanted to give you a little background as one of the partners at Weiner Benefits Group, along with Mike Reckner and myself and our team. Our mission here is to create long-lasting relationships with our employee benefit and financial service clients in the area. It makes us one of the oldest and largest firms out here since 1938. We've been around doing this. And we built long-term relationships, multi-generational relationships in our processes here, because our vision is to provide personal service, be accessible, proactive, innovative, to meet all of your insurance needs with the latest products and services. But looking at everything from a holistic standpoint, from hire to retire and all the way through retirement. On the next page, we give you an idea of the services that we provide for our clients over time that hit all of these areas that bring security to your employees. And for our clients, we have all of the employee benefit services. Alternative healthcare funding is a subject matter today. Strategic planning, HR systems. So we provide the solutions and then the administration support to bring those solutions to your employees. And that includes from health and welfare, medical, dental, life, disability, and so on, but also your retirement service needs as well. So on the next slide, we want to remind you this is part of a series. So we have today the level funding and partial self-funding, but then we're going to talk about captives on the 5th of June and then consortiums on the 12th of June. And these are all recorded, and you'll be able to have access to these, and we'll be able to provide you information later on and along the way. On the next slide, I just want to make sure you're aware of the Weiner Benefits team. You have Mike Reckner and myself as the partners, Denise Renzi, account executive for employee benefits, Stephanie Clendenning, account executive for retirement plan services, Wendy Weingartner, account executive for employee benefits, Tom, our associate advisor, James, our account manager, and Allison, our account manager, as well as our claims and service team, Adele Taylor and Laura Cheesem. We also have Lacey Gross, our support and account administrator for employee benefits, and account coordinator Jen Knoll, and Matt Moody, our client service associate for retirement plans. It's a big team of people that are here to serve you, to help you get across the finish line with everything that you need for your employees and your retirement plans and health and welfare benefits from hire to retire. Today, we're going to let our friends at Crumdale go into detail, but we're going to talk about level funding, which is basically a way to set aside a monthly amount that for your health insurance that includes the cost of administration and other fees, and then creates a claims bucket that you might have access to later on, depending on your claims utilization, but also traditional partial self-funding, which is rather than paying a fixed premium to an insurer, you're actually collecting premiums for fixed costs and then paying claims as you go on a self-funded basis. Super high level. We're going to let the experts at Crumdale talk about this next, and I'm going to turn it over to Stephanie to introduce our friends from Crumdale.
Thank you, Lewis. I'm not going to take much time here. As I mentioned, we have Buzz Hanneman here who will be running through this slideshow. and Bree Bramber as well from Crumdale Associates. So I'm going to let them proceed.
Yes, good morning. Thank you, Stephanie, and thank you, Lou. And look forward to talking to you and getting you a little bit more detail around how a level-funded, self-funded program can work to your advantage as an employer group as you continue to manage healthcare and your healthcare budget. With me today is Bree Bramber. Bree Bramber is one of our local regional sales director in the Northeast. My name is Buzz Hannum. I'm Senior Vice President of Sales here at Crumdale Partners. I've been in the healthcare industry now for 20 plus years. Prior to coming to Crumdale in 2018, I served as a broker, very similar to Lou and his team at Weiner, and providing consulting and advisory services for mid-market groups. I wanted to give you a little bit of background today about Crumdale, but more importantly, we're going to dive into a particular platform that really is about taking what is going on in the Fortune 500, Fortune 1000 of self-funding and drilling it down into a mid-market solution that is going to allow you to take advantage of what looks like a self-funded program, but is going to feel like a level-funded arrangement. And the opportunity here, if you learn nothing today, I want you to take away 3 pieces of information, and that is data, accountability, and control. And really the importance of those 3 elements is if you don't have data, it's very difficult to create accountable actions and proactive solutions that ultimately are going to give you, as an employer, more control on how you manage your healthcare budget. So if you don't take away anything else today, take away those 3 bullet points, and we'll talk and we'll drill into a little bit more about them today. Who we are is we manufacture, underwrite, and administer self-funded plans. We do that for large groups, but again, today we're going to talk about a solution for the small mid-market to allow groups between 25 and typically 300 to have the opportunity to have more transparency and more control about how they manage their healthcare budget. Our company was started actually in 2014 by our CEO, Matt Naylor. Matt's background has been underwriting stop loss for 30 plus years. And really Matt's vision was about creating better alignment between underwriting, stop loss underwriting, health insurance risk, and employer groups. In today's market, it's very difficult to do that based upon how ACA was written in 2010, and medical loss ratio is really, there is no alignment of incentives for carriers to lower claims and ultimately lower premiums. Where our vision at Crumdale was we underwrite every group that comes onto our platform as an underwriting arm for our stop loss partners in Pan American and Zurich. That allows us to then create better controllables in managing the healthcare spend that's going to deliver better results from us as an underwriting arm and you as an employer. And we'll talk a little bit more about that today. But across our organization, we're 150 folks from underwriting to clinical to pharmacy experts to self-funded support on account management and allowing our brokers to deliver better solutions down to their clients, again, to manage their healthcare spend more effectively. So again, we deliver a number of different solutions from pharmacy benefit solutions to medical stop loss to compliance and actuary services, all of which is bundled into our integrated health plan. And again, we'll talk about that is where we're going to focus the conversation about how do we manage healthcare spend for the small to mid-market. So why are we here? So it goes back to what I talked about a little bit earlier when healthcare reform was enacted in ACA in 2010. If you look at the stock price for United Healthcare, it has gone up over 23,000%. And that's correct, 23,000% since 2010. And other healthcare organizations like Cigna, Humana, who's no longer in the health insurance market anymore, their stock prices have continued to rise. And really because at the end of the day, these healthcare organizations, health insurance organizations, the only way that they can increase their shareholder wealth, their profitability because of ACA and medical loss ratio, quite frankly, is only by increasing premiums. And that's ultimately leads to, from their stock price, a greater wealth. But again, it leads employers, particularly in the mid-market, wanting and needing better solutions to help them manage their healthcare spend. So I mentioned the word medical loss ratio, and that's really what was enacted in 2010. Health insurance carriers are required, if they don't hit particular medical loss ratios, that they have to give back rebates. And I'm sure that they are not too excited about giving back claims dollars and premium dollars back to their organizations. So they have literally no incentive as an organization, based upon what they're trying to do from a profitability perspective, to lower and manage claims, which ultimately would be lowering their premium dollars. So really, and again, I encourage you to talk to Lou and his team more about MLR and what that can mean, an opportunity to manage your claims better. And then again, the series that they put together is going to unlock a number of areas where you can attack and manage claims better, that ultimately is going to lead to better long-term results. And again, we'll talk a little bit more about that today. So where this has led us, again, and I'm sure you have seen this graph, again, continuing challenges in U.S. healthcare. The average cost of family premiums continue to rise at an astronomical rate. Worker contributions continue to rise. Again, really what's left is, unfortunately for employers, is we have to raise copays and deductibles. We have to charge more for an employer, for our members, our employees, in order to manage and budget for healthcare increases. Again, there are better ways to do that, and we'll talk a little bit more about how we can help. So really, again, unfortunately, in the fully insured marketplace, there are limited solutions, as I've talked about. Renewals come out 30 to 60 days out, double-digit renewal, no surprise. Do we market? Do we not? You're moving health insurance carriers again as a solution, which creates instability. Unfortunately, not long-term stability with your health insurance carriers. We negotiate the less bad renewal. We cost shift off to higher deductibles and copays, more out of pocket for your employees. And then ultimately, it's time to face the music again. And we stay on this hamster wheel year after year after year. What's not happening, because of the lack of transparency in data, is the ability to utilize that data to manage claims better. And there are solutions available that allow us to do that ultimately aren't available in the fully insured market. And again, we'll talk a little bit more about that. So how do we find the right solution, and what are our options? Well, again, we've got the fully insured. We've talked about that hamster wheel real briefly. Level funded in the carrier world gives us the opportunity to have more data. We can get to retain some unused of that, some unused claims fund. So if you're performing better than what they're predicting, you'll get to split that with the carrier. There is some reporting available. It's usually not very detailed, but that gives us a little bit better picture. It's difficult to create accountability, as we're not really sure like what's happening inside. Many a times, Cigna, Blue Cross, Aetna, they control the ecosystem to a point where it leads to more profitability, particularly around managing high-cost specialty medications. And again, there's no insight from a contractual perspective, so we're very limited around the flexibility and what we can do from a proactive standpoint. What we've done, and through our solution, is to sort of combine the best of both worlds. And again, we'll talk a little bit more about that. But from a self-funded perspective, this is really, truly the best way to manage your healthcare spend, because of the data, the transparency, the accountability, and control. And we get to retain 100% of our claim surplus. We get more reporting, so we can have strategic applications and proactive consultation with you and your broker. There's more detail around the contracts and where the sort of the money is going and how the dollars are being allocated. We've got more control over the vendors and who's coming in and who's coming out. How do we add different cost containment solutions? So ultimately, what's happening in the larger organizations, they have migrated, many of them, into a self-funded arrangement, which leads to better long-term results. So how do we take that and drill that down to a group of 50 employees, 100 employees? We do that by creating a solution that allows us to build a self-funded arrangement, but in a level-funded environment. So it is truly a fully self-funded chassis, but it's going to feel like a level funded environment. And we do that by essentially deconstructing the health plan and building it back up into fully integrated model with best-in-class vendors that's going to lead to utilizing aggregation over the number of groups that we have on the plan. So better pricing, better terms and conditions, better contractual arrangements, better relationships with these vendors, and truly integrate into the health plan. And the three main components that I love to talk about within the health plan are your TPA, which you currently have today if you're fully insured. You just don't know it, you don't see it. You have somebody administering and managing and adjudicating the claims on your behalf. You get access to a network, whether it's Blue Cross, Cigna, and Aetna. You have a pharmacy benefit solution. Typically, Aetna is CVS, Cigna is Express Scripts. So we bring that pharmacy benefit solution as well into the program. And then we provide stop loss coverage, right? We underwrite it, and it's for that catastrophic, for individual and on aggregate claims. So you are covered for those those large claims that are not expected, and a year that you may have more claims than that is anticipated. So we bring all of these elements that are already in your health plan today. We provide a little bit more visibility and transparency with those relationships. We integrate those. They are ultimately independently evaluated. So if one is not performing in the way that we anticipate, we can remove and replace and have a little bit more flexibility about what we can do and how we can manage that. What we're doing is, again, through our TPA relationship, we're creating, again, or for all of these relationships, but starting with the TPA, we're creating a fully integrated health plan. So the TPA, as I mentioned, processes the claims, adjudicates the claims, issues the ID cards, provides the network access, which will be Cigna and Aetna typically with our programs, reporting, more customizations from a plan design perspective, so you have a little bit more flexibility. That's typically what a TPA does. Under our platform, we're sitting over top of that. We're the underwriting arm, so we're actually taking a portion of risk inside the platform, which aligns with how we can lower and manage claims, because at the end of the day, we have financial stake in that as well. We're able to see more claims activity. We have less auto adjudication, and we're managing claims down to a lower level than what's typical in the carrier market. And we're seeing on average about 5 to 7 reduction in claim spend simply by better oversight, less auto adjudication. A lot of times there's duplication, there's incorrect coding, there's egregious charges, not necessarily maliciously by the providers of the facilities, but these errors happen all the time. And ultimately in the carrier model, they don't have the ability, nor, as I mentioned, did they have the incentive to lower and manage those claims, because ultimately that's not aligned with their profitability and their P&L statement from a carrier perspective. So we're deploying all these resources, we're managing claims more effectively, and allowing you to take advantage of the opportunity to reduce your claim spend, which is going to lead to better results. The second piece is the pharmacy benefit manager, what we call a PBM. And I apologize, the insurance business is full of acronyms, and will do my best to make sure I explain them as best I can. So pharmacy benefit manager, that is the vendor that adjudicates and manages your pharmacy claims. So again, 98% of your population utilizes the retail, CVS, the Walgreens, the grocery store chains to fill their 30-day retail. They do mail order. The biggest piece, and if you go to the next slide, Stephanie, is really around how do we manage the high-cost specialty medications? Because this is really what's driving majority of employers' cost. You have a significant amount of challenges with many employees and members, right? It's really important for them to continue to adhere to their treatment plan, but a lot of these high-cost specialty medications, whether it's for rheumatoid arthritis, whether it's for heart conditions, whether it's for MS, they are very expensive. These are typically the medications you see if you watch sporting events on Saturdays and Sundays. They advertise really well, but those are very, very high price tags, $100,000, $200,000, $300,000 a year. these specialty drugs typically make up a significant volume of your claim spend. For many of you, if you're 50 employees, there's probably 2 employees that are 60, 70, 80% of your claims. And it's really important that they adhere to those treatment plans. But there are better ways, and there are strategies that we can access these high-cost specialty medications, in some cases at 75% off of that $200,000, $300,000 cost. And we can utilize, again, direct connection to drug manufacturer, other sourcing and wholesale arrangements to significantly control and manage that pharmacy spend. So if you click all the way through here, Stephanie, there's a couple of elements here. So what we've created is a contract with our pharmacy benefit manager that allows for discounts and rebates. Again, good financials, really good guarantees. But at the end of the day, we want to minimize disruption and bring a lower net cost to you as an employer. So as I mentioned, 98% of your population will have no change whatsoever as far as what they're doing today and their typical retail medications, their generic medications, and what they do today. What we're going to focus is how do we manage the high-cost specialty medications? We will not change disruption, and a lot of times we'll give better access to those employees. So for instance, a high-cost medication, Humira, which is probably one you hear about all the time, has multiple solutions. It is the most utilized specialty medication. It now has generic available as of this time last year. So we have the ability to source it through different wholesale arrangements, also utilize what we call biosimilars, which is a generic alternative. And that 100,000 drug can be mitigated to a $20,000 cost. All in the same time, providing zero out-of-pocket cost to your employees. So there are these opportunities to do that, where in the carrier model, quite frankly, they're not going to give you access to these opportunities because at the end of the day, they're making too much money in filling those high-cost specialty medications through their relationships with their pharmacy benefit managers. And we're going to create a better separate way. We're going to manage it with our clinicians and pharmacists and ultimately deliver better results moving forward. So again, I talked about some of the solutions that are available that you might not be privy to. I don't want to go into too much detail, and much rather you reach out to Lou about what these strategies will provide. But again, through our relationship, these available programs that can significantly lower your high-cost specialty medications that are inside your program, again, 50, 60, 70, 80% of the cost of the medication are all available inside our self-funded, level-funded program. And that's really, again, where we can change the trajectory for a lot of these groups. So specialty medications, again, as you can see, they are significant claim spend inside many of our groups. Many of these medications, again, you may be familiar with. You may even know inside your population with the limited data you have that these medications are occurring today and the annual costs associated with them. There are solutions available that ultimately allow us to get better access to these medications at a better cost. And as I mentioned, save the employee significant money. So these are the top opportunities that we see on a regular basis. The average plan spend, and then ultimately the plan savings, but also we've associated the member savings associated with them. That's just due to our book of business and the plan designs that we have. And again, many times deductible and copays are waived, $0 out of pocket for utilizing these solutions for your members. So we're very much, as we talk about a carrot and a stick approach, this is a carrot approach that it gives them a better spend and a better opportunity to move forward. And these are just some examples that we've had. We have currently on our platform over 500 groups. These are just some examples of small to mid-market groups and simply how we've changed the trajectory about how they manage their plan spend moving forward. The last one I will just give you the significant impact for. As you can see, their plan cost without the program was around $209,000. These were a couple of medications. What we were able to do is remove a significant portion of these medications through some of the arrangements that I had talked about earlier. The savings was $195,000 to this 46 life group. they roughly had around $300,000 to $350,000 of total claim spend. So we've now reduced that to roughly about $100,000. Talking about changing trajectory for that long-term sustainability for that group, it's significant. And for both of those two members, for this 46 life group, they were able to get those medications at zero cost. So these are real life examples. It happens every day. We see it all the time. And again, we're able to address those significant claims as well as provide a better solution for those members. So again, we talked about the carrier from a level funded perspective and what this looks like from a self-funded, level funded inside our solution. We utilize two national networks, Aetna and Cigna. If you go to the next slide, Stephanie, we again, so from your employees and their members and their families, they will have national access, great access for those in Delaware and Pennsylvania. We have clients in all three of those states. New Jersey, Pennsylvania, and Delaware. We have clients nationally, and these two networks work really well. We can also get some creativity depending on how creative your broker and you would like to get. And there's a number of ways to do that through our independent TPA relationships. And again, I encourage you to reach out to Lou and his team to talk more about the creativity. But at the end of the day, what we want is what you're doing today in a fully insured market. We want to make that ease of transition very easy. So again, you're going to get national network. From a budget perspective, you'll have one fixed budget cost, both fixed cost and claims on a monthly basis. If enrollment stays consistent, those 12 monthly payments will be the same. And we would show you a max proposal, and you would never pay any more than that max proposal. And at the end of the year, if we're able to beat that actuary prediction, we're both incentivized to do so, that 100% of claims 100% of claims surplus is retained by the client. And again, we're utilizing different cost containment strategies to manage and get to that lowest net cost so we can have the results that we anticipate, so we can continue to have our clients on for a long-term solution.
Buzz, can I stop you for a moment and ask a question?
Please.
This has been really great so far. I was wondering, on this page, you mentioned Aetna and Cigna. Does Crumdale use the Highmark network as well, or do they only have access to certain network providers?
Yep, we only have certain, so the only Aetna and Cigna are available through our independent TPA relationships.
Okay.
And that's intentional. A lot of times we don't get the ability to utilize the cost containment solutions that I've talked about with Blue Cross networks because they want to continue to keep the pharmacy opportunity within their house. And so by utilizing our independent TPAs and our national networks, we can strip out the pharmacy spend, manage that more effectively and closely, which gives us better opportunity to manage the claims as I've discussed. So that's one of the reasons why we do that.
Awesome. Very helpful.
And Buzz, going along that thought process, from the purview of your service area, how's the network penetration of Cigna and Aetna versus Highmark or Blue Cross in general?
Yeah, so again, from a network access perspective, there's always a couple of percentage differences, both plus or minus in some cases, where Aetna and Cigna is going to be better from an access than Highmark standpoint. We often hear, well, the Blue Cross discount. I can tell you, based upon how we manage claims, that discount is going to be very small percentage, and in some cases it will be better through us because of that. Again, just understanding where the claims are coming from and how we're going to best perform is typically where we want to go. And we can always do a geo access or some sort of network disruption to make sure, again, that we're not leaving any individuals bare or in a large distance away from access to the providers and facilities.
And we know that that's always a process, and with our own clients looking at the various networks and their access, helping our clients walk through that process and making sure all of their employees are covered regardless of the network. Our service team and our folks here are really good at helping our clients walk through that process as well.
Thank you, Lou. And so lastly, I'll just talk about the stop loss piece. It is, again, something that is really important from our perspective, and again, aligns us with each and every group that comes onto our platform. As I mentioned, we have over 500 groups. We've averaged, as of January 1, 2024, our average renewal was just over 4%. We have an average savings for each group that comes onto our platform of 21%, and that has to do with how we manage and mitigate claims. And it really has to do with the stop loss standpoint. So as I mentioned, we underwrite every group that comes on to our platform. So it's us, Crumdale Partners, that is actually has the underwriting authority for Pan American and Zurich, which are two A-rated carriers who are going to financially support you for catastrophic loss, catastrophic claims above a certain individual amount and above the aggregate for the total group amount. What's really important about that, as I mentioned, is again, we take a risk position that allows us to then be in the same lane as the employers about managing and lowering claims. We want to be, again, at the same thought process about how we can create better performance and do that by creating a full health care plan like we've done, manage that more effectively with cost containment strategies, better data that allows us to consult and work proactively with the brokers to develop cost containment strategies and better proactive conversations around what we can do with the utilization that's happening inside those groups. And ultimately, we're creating better performance. So what we're doing is we're bringing in really good groups. We're managing them to a more effective level from a claims perspective. So essentially what we've done is we've created a pool that has a much higher level of integrity than a lot of carriers or other solutions that are out there. And that's really important because, again, if you think about it, you're in this pool with all these other employers. And what we want to do is continue to maintain stability. And as I tell every employer when we do a presentation for them and do a proposal meeting and finalist meeting, out of 5 years, you will have a bad claims year. I will tell you that. But when you have that tough claims year, what we're doing is we're mitigating that because of our volume, because of how we're managing claims, so that you do not have to have that volatility of a tough claims year. And we can mitigate that and create, again, better long-term stability inside our pool because of how we manage it more effectively, how we're underwriting it, and how we're developing the cost containment strategies and attacking where the claims are to create better solutions. So again, this just talks a little bit more about our dynamic ISET on understanding the client needs, creating aggregation and quality through that analysis, understanding the cost drivers and the solutions that are available so we can better underwrite those groups coming on. And then obviously at renewal, we're taking the opportunity based upon how we're managing those claims with our independent TPA relationships, with our pharmacy solutions, with the other cost containment pieces to create better upfront discounts for better risk reduction. So you're getting the benefit of what we do in the ecosystem when we underwrite each group, and then obviously at renewal. And the other piece I will talk about, just again, that I didn't mention earlier, was from a member standpoint, we have advocacy. So they'll have care and benefit navigation. These are our employees that are healthcare experts to help them navigate the solutions when it comes to healthcare, getting the right providers in network, determining cost of a knee surgery that they might have in 6 months and what that means from an out-of-pocket, and then also understanding where they can find the highest quality at the lowest cost within their in-network providers. We also provide a telemedicine service for 24/7 so that they can utilize that on a regular basis to avoid going to the urgent care or going to the emergency room, the cost, the time, and ultimately, disrupting a lot of times when we're on vacation, there's always the ear infection that my daughters used to get. We can manage that through telemedicine. So there's a lot of pieces that are already integrated and pre-integrated into the solution to help deliver better results, better experiences, and better outcomes.
Awesome. Thank you, Buzz. This was very helpful. I don't have any questions or questions in the Q&A or questions in the chat at this time. Lewis, Denise, James, Wendy, any thoughts, anything that you think maybe clients may want to ask but haven't asked, or a good question that you think should be addressed?
Buzz, can you talk about, we do have clients that are currently level funded with Aetna AFA.
Mhm.
Can you speak about the differences between the Aetna level funded and Cromdale level funded, and what
Yeah.
makes you different than them?
Absolutely. Great question, Denise. So from a budgeting perspective, it'll feel very similar to what they currently do from an AFA standpoint as far as, sort of the monthly cost. What's going to be different is a couple of things. First off, they're going to see where every dollar goes. So there will be, from an invoicing standpoint, they'll see where the fixed costs are going as well as their claims fund and how that's performing. In addition, unlike AFA, there's typically a shared surplus. Ours is going to be 100% of surplus retained. So they're going to have the ability to retain all of that surplus for them. Number two is the data and the transparency is going to be far greater than what they currently get from Aetna and AFA. So it is very granular in the utilization and the analytics reports that are provided. So starting day one, you're going to actually see where every dollar is going, where the spend is happening, where things are trending, and ultimately how to address those on a more proactive basis. And then finally, again, as I talked about, it's really about how do we manage the claims better. The cost containment strategies that we're going to bring to the table, again, primarily focused on managing high cost specialty medications, typically not available in level funded arrangements, whether through Aetna or anyone else. And we're going to be able to, with our clinicians and our pharmacists, dive into better ways that employees can access those high cost medications at a better cost structure. And then ultimately, as I mentioned, save the plan significant money moving forward. So there's a number of differences there. I think there's, again, we've had a high level of success in showing that difference to employers and why they should think about and consider a move into our direction.
Thank you.
Welcome.
Any other questions or comments?
No, I think this has been a very informative, very good presentation, Buzz and Bree. Thank you so much.
Our pleasure. Thanks for having us. If there's any questions from those on the call that come in later, happy to take those up. And I encourage those on the phone to talk to Lou and his team about better ways to manage healthcare spend and the solutions that are available across the board.
Awesome. Well, thank you. I hope everyone enjoys the rest of their week. And again, if you would like to have the recording after this call, please reach out and we'll be happy to provide that. And of course, talk in more detail on this content. Have a great day.
Sounds great.
Bye.
Thank you.
Thanks, everybody.